Doctor, I think I have malaria and typhoid.
What made you say so? Malaria and typhoid may share some symptoms, but they are caused by different organisms and spread in different ways. Malaria is an infectious disease caused by Plasmodium parasite. It can be life-threatening. Typhoid fever is a serious bacterial infection caused by Salmonella typhi bacteria of Salmonella paratyphi.
Doctor, can I have both diseases at the same time? Because I have always been treated for both.
Yes, it's possible. Although typhoid fever and malaria can coexist at the same time for the same person, it is not always the case as commonly insinuated. They are two disease entities independent of each other and have different causative organisms, mechanism, diagnosis, and treatment.
I see. So how do we get infected?
Malaria parasite is spread through the bite of an infected female Anopheles mosquito. Typhoid is spread through ingestion of food or water contaminated with feces from an infected person.
Really? So if I'm hygienic and drink clean water, I'm less likely to get infected?
Yes, exactly. Those are key preventive measures.
So doctor, how do I tell which one is causing my illness now?
They may be caused by different organisms, but they share similar symptoms. However, classic manifestation of typhoid fever include low heart rate, pulse temperature dissociation, and what is described as rose spot. Rose spot is a faint salmon-colored macules on the trunk and abdomen.
Oh, I see.
That's correct. While the fever in malaria is intermittent and cyclical, in typhoid fever it is sustained and high. In malaria, abdominal pain can sometimes occur, but in typhoid fever, abdominal pain is very common. Also very common in typhoid fever is diarrhea or constipation.
I see. Thank you, doctor.
For diagnosis, malaria can be diagnosed with a rapid diagnostic test using immunochromatographic method.
Okay. And the best test?
The gold standard is a well-prepared and well-stained blood film. For typhoid fever, blood culture or stool culture remains the gold standard for its diagnosis, but it requires laboratory equipment and technical training that are nonetheless lacking in most of our primary healthcare centers. And because of this, Widal test that is readily available and inexpensive is resorted to in the diagnosis of typhoid fever in this center.
Does it matter whether it's blood culture or Widal test that is used?
The Widal test is not reliable for typhoid diagnosis. It only proves exposure to the antigen, not a recent infection.
So it's not useful?
Correct. We need better tests.
So doctor, are they treated the same way?
No. For malaria treatment, antimalarial drugs like artemisinin-based combination therapy and other antimalarial medications is used. While for typhoid fever, antibiotics are used for its treatment.
Oh, I now understand it clearly. But how do I prevent being infected?
We'll discuss hygiene and vaccination. To prevent malaria, avoid mosquito bites by using insecticide-treated nets, repellents, and in some cases, malaria prophylaxis.
Okay, I understand.
To prevent typhoid fever, ensure clean water, proper sanitation, good hygiene, and typhoid vaccination.
Thank you very much, doctor.
Your results are in, and they're great.
Really? That's a relief.
Yes, everything looks perfect.